go ahead and ask away. Otherwise, I'll just start reviewing. So as I said, this is for Boyce Campus Nursing 230. Um, the things that we went over last time, I just kind of picked and chose a couple of examples to work through. And so that's kind of what I'm going to do is just continue that process. We did a two-step problem where we accounted for the patient's weight. This was more of like a or a pediatric type question, but um, you're going to get a whole separate pediatric dosage class this semester. So you'll learn a little bit more about that. I have some videos on YouTube that are relative to that. So if you need to reference those, I have a playlist and it just says pediatric dosage calculations. You're welcome to reference those if you need to. If there's other questions you have, you can always email me too, and I can um, give you the solutions or help you out with them if you need help. All right. So I just was going to go through, I just want to revisit what I already went through. Um, I went through the heparin protocol. That's something that is new for you this semester. So you haven't seen the heparin protocol yet, unless you saw it like ATI or obviously one of my previous review sessions. I don't think Boyce gets ahead on this. This is new. Some of the heparin infusion questions are based off of like, can you convert units per hour to milliliters per hour or milliliters per hour to units per hour if you need to be? Or they might give you this thing that's called the heparin protocol, where there are two questions you need to answer. You need to be able to calculate the bolus and you need to be able to calculate the infusion rate. And so I worked through that on Tuesday. So I have some other examples that I will work through for heparin. And that's probably the thing that I would say, since it's new, is the thing that I'll focus on first and foremost. So I think I only did, okay, I did a couple other examples. I just wanted to see what else I did here. So I'm going to work through some of these, like I call them like prep questions, because what these questions are examples of going from milliliters per hour to units per hour, and then units per hour to milliliters per hour, because you need to know how to do that conversion prior to doing the heparin protocol. I'm just going to show you the way that I've done it. If you've been on reviews with me before, you know that I always say there's not just one right way to do it. If there's another way, or if you have a question about the way I'm doing it, please ask, because I want to clarify. But you can do any number of ways. Just make sure whatever way you're doing consistently gives you the right answer. Um, yes, I will. I'll go back up to question 9 after I do a couple of these heparin protocols. So thanks. So if I forget, please remind me. Okay. So I'm going to look at 21, and mainly because 21 is actually, before I look at 21, uh, I want to look at 23 first. The reason being is because 23 is most likely what you're going to see. 21 is probably what you would see like on ATI. You might see 21 or something similar to 21 on your test. I don't think so, but I want to show you 23, and then we'll go back up and do a heparin protocol, and then I'll do question 9 on this as well. So for 23, what this question ultimately is asking you to do is it's asking you to take this order that involves this IV. The IV, it has 250 ml and 25,000 units, and it tells you that it's infusing at a particular rate. So the rate that it's infusing at is 2,500 units per hour. What they want to know is, what is that rate in milliliters per hour? And so I'm going to show you how to do that. So what you're going to do is you are going to take uh, this is my strategy. So if you decide you want to do this a different way, again, if you're getting the same answer, great. But I always say in my mind, I'm thinking, okay, I'm just going from units per hour to milliliters per hour. And what I want to do is just convert units to milliliters. If I can do that, then great. Uh-oh. I don't know if somebody hit a button for transcription. It might affect the quality of the video, but we'll see. And just so you know, YouTube automatically transcribes these videos after it's all done and over with. So I don't know if that was somebody clicked on something or or if it's just doing it automatically. But if it gets laggy, just I'm just letting you know that um, that might happen. So I hope it doesn't, but it might. All right. So what's going to happen here is we're going to go with our flow rate, and I'm going to start off with my flow rate, which is 2,500 units per hour. Again, this is just my preference. If you have another way of solving this, this is just how I do this. Okay. Now, what I'm looking for, my ultimate end is I want to know how many milliliters per hour this is going to be. Okay. So that's what I'm looking for. So the question is, can I convert units to milliliters? So in order to convert units to milliliters, I need to be able to eliminate units and get milliliters. And we have a way to do that. That's what this um, IV allows us to do. So all I'm going to do is plug in the numbers associated with your IV bag. 250 ml up here, 25,000 units down here. Okay. Then all I'm going to do is, well, actually, oh yeah, I still need to plug this in because it says 2,500, not 25,000. So I'm going to take 2,500 times 250, and I get 625,000. And then I'm going to divide by 25,000. 1, 2, 3. And I get a flow rate of 25 ml per hour. So like I said, if you do it a different way, if you're trying to do ordered over available or desired over have or whatever you call that, um, it's challenging to do that directly without making the occasional mistake. And so one of the reasons I always write these out, whether or not you like dimensional analysis, I write these out just because it simplifies and we can see everything's there on the table. I can see that before I do any calculations that I'm left with ml an hour in the right positions. So sometimes students will rearrange things like incorrectly, and then they get some number that seems to make sense, but then it it just doesn't work out. So or they get like a decimal answer, and that's not a right answer either. And ultimately, when I review those things, what I see is that they basically multiplied units on top of each other. So units times units is actually units squared. And then they have units squared per milliliter of hour. And that obviously doesn't make any sense. So that's why I think this is always important to like cancel these things out until you feel comfortable with it. I personally, when I look at this, I don't even write anything down. I just plug in my calculator. I take 2,500 times 250 divided by 25,000, and then I get my answer because I know that that's the flow of this particular question. Okay. All right. So I'm going to come up here now and I'm going to do the reverse. Um, so in this question, we actually start off with ml per hour, and it tells us our um, what we have in our IV. So it's 22,500 units per 500 ml. So it's different numbers. And the question is how many units per hour. Okay, so we're actually going in the reverse. So in the previous question, we went from units per hour to milliliters per hour. Now we're going from milliliters per hour to units per hour. So they could ask you this. Believe it or not, like I created a YouTube video about this a couple of years ago, and it's by far the most popular YouTube video that I have. It was like an old PowerPoint like breakdown, and it's has the most views of any of my content other than my original heparin protocol questions. So obviously it's a question that gets asked. I think it's more of an ATI question though, because I don't know that they ask you on tests, but just in case, you'll know how to do it now. So I'm going to follow the same strategy that I did previously, but I'm going to rearrange um, the things. So, like I said, my strategy is I'm going to start with my known or my order, right? Or my given, which is the 25 ml per hour. I'm going to multiply it by something that I'm hoping will help me to convert ml per hour to units per hour. Okay. So the reason I'm, like I said, the reason I'm walking through this and telling you all this is because I just want you to understand like what my strategy is. Okay. I'm trying to get rid of milliliters, exchange it for units, and keep hours on the bottom. And so that's what I'm going to do. So I want to get rid of ml. Okay. So I want to be able to cross out ml and have units on the top. So if I can do that, then great. And guess what allows me to do that? The fact that we have this 22,500 units per 500 ml IV. Okay. So all I'm going to do is plug in the numbers where they go. With units, it's the 22,500 and 500 for the ml. So before I do anything, right? Before I do any math, before I plug anything into my calculator, I can see that I'm in units per hour. So I'm going to take 25 times 22,500, and that gives me 562,500. And I'm going to divide by 500. And I'm going to get some crazy number. Seems crazy. And it's going to be 1,125 units per hour. Now, when you see some of the numbers associated with units per hour for heparin, even in the heparin protocol, this is actually not a ridiculous number, okay? Because even though that's 1,125 units per hour, going back, it's only at 25 ml per hour. So it's actually coming out quite slowly and being infused quite slowly. That's why they call it a heparin drip, even though we're not calculating for a drop rate. Okay. All right. So since I'm in this kind of vicinity, I think, yes. What I'm going to do is I want to work through 22 because 22 is a good example of the type of, or potentially a type of heparin question that you might see on your test. So I'm just going to do that. All right. So with the heparin protocol, it's going to give you a bunch of information, and you're going to have to kind of put together and assimilate a lot of skills that you've learned over the last couple of semesters. Um, Converting pounds to kilograms, and then converting units to milliliters, and then converting units per hour to milliliters per hour. So what this is just a protocol. Someone's, on bed rest or is in a hospital bed after some sort of surgery, like a hip surgery or hip replacement surgery, or got a broken leg and they're elderly and they're not going to be weight bearing for a while. We want to make sure they're not clotting. We also want to make sure they don't bleed out. And so you do these different protocols. So it gives us a couple things, and this is actually a little bit more of a challenging one than the first one I shared, but we're going to go through it. So the first thing it tells you is they did the prothrombin time and they find out that that number is 42. I think it's 42 seconds. Then it says, according to the protocol, you need to increase the heparin drip by 2 units per kilogram per hour. Okay, so we really don't know what the original one is yet, but we're going to get there. Then it says to administer and administer a 30 unit per kilogram IV bolus. So they're asking us to increase an infusion rate. So they're already on a protocol. Okay, they're already receiving heparin. We're going to bolus them again, and then we're going to increase the infusion rate because it sounds like they are not responding to the clotting measures that we want to, or the anti-clotting measures that we want them to. Says you'll recheck in 6 hours. The patient is currently receiving, so they're currently receiving 16 units per kilogram per hour. I'm just gonna highlight that. So that's their current infusion is at 16 units per kilogram per hour. They're receiving that 16 units per kilogram per hour from the following IV. It's a 25,000 unit IV in 250 ml. Okay, so that's where the heparin is, and that's what they're plugged into, and that's how they're receiving that infusion. We can see the patient's weight, 163 pounds. And then the question states, and this is what I was mentioning earlier. If you haven't answered a question like this, they're going to ask you two questions. The first one is, how many units will the patient receive as a bolus? I'm actually going to change that question. I'm going to say how many ml because I want you to practice that. So how many ml for the bolus? So ml for the bolus. And then what will you change the flow rate to in ml per hour? So we're going to do two things. We're going to solve for the bolus and we're going to solve for the infusion rate, the new infusion rate. All right. So let's work through this. So the main reason for me highlighting those things is just so when you come back and you're looking at this, you can review some of the things that are listed there and know that that's the important parts of the question. So you should still read the whole question, but what I've highlighted are the important parts. Like we don't care about for answering this question that we're going to recheck in 6 hours. We actually don't even care that their PTT, I think it's actually supposed to be their APTT, but it's 42 seconds. We just care about following the protocol. So step one with these types of questions is we want to take the patient's weight and convert it to kilograms. So I think most of you, if not all of you, already know, you just take the patient's weight in pounds, divide by 2.2. So divide by 2.2. And I'm going to get 74.090909. We're just going to round that up to 74.1. All right. So with the patient's weight of 74.1 kilograms, the first thing I want to do is I want to get rid of those kilograms and apply it to the order. The order says increase the heparin group by 2 units per kilogram per hour and to administer a 30 unit per kilogram IV bolus. So we're going to start with the bolus dose because I think that's the one that's most straightforward. Um, there's also information listed here, missing here. I always forget that. So if you come back to this, there are some details that were missing in this, and I just added in a really important one, especially since, and that's probably why the question said how many units of bolus, but I wanted you to practice because I think when you get this question, I think you're going to convert it into ML. All right. So I added in another piece of information is that the available bolus dose is 1,000 units per milliliter. Now, the reason that's important is because for bolus, we want to use the bolus dose available. And for the infusion rate, we want to use what's in the IV bag. So you should have two pieces of that information. If they don't give it to you and they're just asking for the units, then you don't need to worry about it. But like I said, I wanted you to practice the converting to milliliters, and then it'll make sense in just a minute. So what we're going to do is before we even worry about that available, I'm just going to multiply by the order, which is the 30 units per kilogram. This helps me get rid of kilograms. And then if we were only calculating units, this is the only, we'd be done after this step. So I'm going to take that 74.1 times 30. I want to get 2,223 units. So If that's all the question asked, we'd be done. Okay. That's how many units of the bolus you administer. But because I've added a couple extra details and I'm asking you to calculate the ml, we have to do one more step, and that is to convert units to milliliters. So I need to have the two pieces of information to do that. I need to have some sort of measure of units per milliliter. You have two options, two availables. You have a um, IV bag that reads 25,000 units, 250 ml, and then you have the bolus dose, 1,000 units per ml. We are calculating the bolus, so I'm going to use the bolus dose information. So we have 1,000 units, and we have 1 ml. Now what we're going to get is our final answer of 2.223. So we're just going to say 2.2 ml. So that's how much you would give this patient based off of their weight and off of the order uh, listed there. So that's part one. So you would need to answer both questions because it's asking you how much to give for the bolus and also what to do for the infusion rate. So let's look at the infusion rate. So I'm going to start off again with the patient's weight, which is the 74.1 kg. Now, the clue that you need to incorporate the patient's weight is the fact that your orders include the kilogram listing there. Okay. So you want to make sure you incorporate that when you are um, answering these questions. So I have 74.1 kilograms and we're calculating the infusion rate. Now it says we're increasing it by 2 and our original was 16. So all I'm going to do there is I'm just going to add them together. So 16 plus 2 will give me 18 units per kilogram hour. We get rid of kilograms. And then 74.1 times 18 will give me 1,333.8 units per hour. So 1,333.8 units per hour. Now, this is something that we just went over, and hopefully with some practice, it'll just become secondhand nature to you. All we're doing now is converting units per hour to milliliters per hour. So if you ever get stuck and you're ever just kind of trying to figure out like, what do I do next? Get rid of the units. So the first thing I do is I write units in the opposite section of where what I'm trying to get rid of. And then what do I want? I want milliliters. So I write that one on top. This cancels out. And then we're left with, before I do any calculations, we're left with milliliters per hour. Okay. Now, the next question is, well, then what units of milliliters do I use? Well, we're calculating an infusion. We're not calculating a bolus, so we're not going to use the bolus dose information. We're going to use the IV. So I'm going to transfer down the 25,000 units, the 250 ml, and we're going to do that calculation, and we're going to get 13.3 ml per hour. So I always say it's a good idea to round to nearest tenth, even in ml per hour. That may not technically be a correct thing that you could put in an actual infusion pump, but they do want you to round to nearest tenth with things like mLs. So just make sure you're doing that. And then if you're told otherwise, then please listen to whatever instructions you're given. However, I have learned that over the course of doing these things, a lot of times they'll give you things that end in a whole number, and so you don't have to worry about the whole rounding thing. So hopefully that's how the test goes. But if it doesn't, you know now how it gets rounded if it if need be. Okay. So like I said, I have a couple of these to practice. Um, if you want to change these questions, the best thing you can do is just start off by changing the patient's weight. So like this patient was 163 pounds. You can put in your weight or a friend's weight, parents' weight, significant other's weight, and then just do run through the calculations for practice. And then if you are wanting some verification on it, just let me know what information you used and what weight, and I can give you feedback. You can always email me that if need be. All right. So I'm gonna go back up to number 9 since that was asked and I remembered. Okay, this is a good question. Um, so number 9 is what we're doing here is we are going and introducing a drop rate. Now, one of the things that you have to pay attention to is what questions are they asking you here? So, and I know at Boyce, they're going to say things like, what is the flow rate? And you need to know whether it's ml per hour, units per hour, drops per minute, whatever it is that they're looking for. I would say typically when it just indicates flow rate, they want to know ml per hour. But anytime that they introduce something like a drop factor, the drop factor is most likely indicating that they are looking for the drop rate. Saying that, you might want to write both answers so that they know that you know both both ways. So what I'm going to do is I'm going to calculate the drop rate first because that's what I'm assuming they're asking for. So a couple things, and it's not listed here, but you need to know that when they mention a drop factor of 20, the units for a drop factor are drops per milliliter. So they're expecting that you already know that. I have a feeling that if you get asked a question like this, like these were just picked out from different sources online, probably even some ATI type questions. So I know that the questions that you get asked in your test usually give you some indication of the units for the things, but if it doesn't, just know that a drop factor is drops per milliliter. All right. So if you don't recall this from last semester, in order to calculate a drop rate, I need two pieces of information. I need the flow rate. I need the drop factor. And those two pieces of information will give me the drop rate. And the drop rate is going to be in drops per minute. It's supposed to be GTT. So that's what I'm going to start off with, and then I'll show you how to get the ml per hour flow rate because I'm not going to use ml per hour. So flow rate is always volume over time. So I'm going to look at my label here, and it says gentamicin 60 milligrams. Wonderful. Then it says 50 mil over 15 minutes. This is what I need in order to calculate the flow rate. What I don't need is I don't need to know about the medication. I don't need to know the strength of the medication. And I also don't need to know that it's going to happen every 6 hours. Okay. This is a way to kind of get you off track. And then that's why it's important to kind of be able to suss out what's important in these types of questions. And so what's important is what is the flow rate? So the flow rate, as listed, is 50 ml per 15 minutes. Then we're going to multiply by the drop factor, which is 20. Millimoles cancel out. We're left with drops per minute. So we're going to take 20 times 50, which gives me 1,000. I'm going to divide by 15. And I'm going to get 66.6 repeating. Okay. We can't give somebody a partial drop. So when you see something like, something like this going and it just keeps going on, and you know that you can't give a partial drop, this is going to be 67 drops per minute. So it is important to recall that when you are um, doing drop calculations, you always round to the nearest whole number. So if this was 66.11111, it would just be 66 drops per minute. And then if it's a number, if it's five or greater, then you would round up to the nearest whole number. This is kind of the one area where you do want to calculate to the nearest whole number. Now, that's one answer. Okay, that's the drop rate. If they were technically just looking for the flow rate, the flow rate would just be volume over time, so the 50 ml over 15 minutes. And then what we would just do is convert minutes to hours. And then what that'll do is allow us to get our ml per hour, so that just in case you need it. I don't think that they're asking you to do that, but if I don't tell you this strategy, then I'd rather you write this down. But I don't think it's going to be a challenge to figure out what they're asking you for, without knowing specifically the other factors associated with this particular question. That's why I'm going off of the very strong assumption that they want you to calculate drop rate, not necessarily ml per hour, but that's how you would do both of those within that same question. All right, so I've shown you the new stuff, and we went over number 9. Are there any other questions that you have that you want to see work through, or question types that you might want to work through? Just let me know. Like I said, type in the chat or unmute and let me know. If you don't have any questions, I'm just gonna start working through some other ones. Thank you. So what I'm gonna do is, okay, yep, I can do 25. Thank you. All right. So, yeah, this is a good question because there's a couple of these. You can see I wrote some additional examples of 25 as they're like kind of continuing down here. So in this particular question, this is another type of conversion where they're going from micrograms per minute and they want you to do all these conversions to get to ml per hour. So again, this is considered like a more difficult or challenging question because there's more of a multi-step approach. Um, and so let's go through it. So it says you're preparing for an interfacility transfer. Your patient is on nitroglycerin drip, 50 micrograms per minute. You notice that the nitroglycerin is mixed at 25 milligrams in 250 ml bottle. And then it has a concentration of 100 micrograms per milliliter. The question is, what is the flow rate that you will set your infusion pump to? So the trick to this is they're giving you a couple extra pieces of information. They're actually stating the milligrams per milliliter and the micrograms per milliliter within the same thing. And you've probably noticed that on some of your medication labels, is that they will have like the mg per ml, and then right underneath it, they'll have the micrograms per milliliter. Okay. Um, and so that's basically what this is, just in text form. And so one of the things that's nice is that since we already know the micrograms, I don't really need to worry about the milligrams per ml because it's already been established that it's micrograms. My order's in micrograms. So I really don't need to do too much with that. So all I really need to worry about is converting micrograms to milliliters and then converting minutes to hours. And we can do that right now. So I always like to start with my order. So my order is 50 micrograms per minute. And then what I'm going to do is I'm going to convert micrograms to milliliters. And I'm going to do so by using what we have available. So I'm getting rid of micrograms and converting it to milliliters. That's 101. And so what I'm going to get is 0.5 ml per minute. We don't want ml per minute. We want ml per hour. So the next thing I need to do is convert minutes to hours. So minute to hour, 1 hour, 60 minutes. And I'm going to get an answer of 30 ml per hour. Now, for a question like this, where you have like, when we look down below at like 26, you'll see that your order is in micrograms per minute, but then your available is in milligrams per ml. So you need to be able, you must convert either micrograms to milligrams or milligrams to micrograms in order to compare those things. You cannot just without doing any kind of conversion um, work like within the same problem or expect that you're canceling out milligrams and micrograms. You need to make sure that they are the same unit before you try and do math with those. So for practice, why don't I just work through that? That way you can see what I mean. So for this question, what I'm going to do is I know that there's 1,000 micrograms in a milligram. Okay. And I also know that I need to convert minutes to hours. So I'm actually going to do that step first because what it's going to do is going to make a nice big number for the micrograms. And then, so I can make that conversion and I'm dealing with a bigger decimal number as opposed to like a very small decimal number. What I mean by that is if I convert right now the micrograms to milligrams. So I take 60 and I divide by 1,000. I get 0.06. It's very, very easy to write that number incorrectly, like on your calculator, or you accidentally just type in zero point 0.6. And so I try to eliminate those types of things as best I can. The other thing is if I convert milligrams to micrograms right off the bat, so 50 times 1,000, I get 50,000, micrograms, and I just it's just a big number, and I don't want to have to deal with that big number. So I'm gonna do the conversion of minutes to hours first, then deal with the the conversion of micrograms to milligrams. So I'm gonna take my 60 micrograms per minute. I'm going to multiply by my 60 minutes per hour. So minutes are gone. I'm now going to be in micrograms per hour. I'm going to be at 3,600 micrograms per hour. Now, I could just convert this. I could just move the decimal over so that becomes 3.6 milligrams. But just for practice sake, and just in case you just need a little extra work on this, when we go from micrograms to milligrams, 1 milligram is 1,000 micrograms. We just cross those out. And then I get my 3.6 milligrams per hour. And then all I got to do now is convert milligrams per hour to milliliters per hour. So I'm going to get rid of milligrams, multiply by ml. My order says I have 50 milligrams, 250 ml. And then when I get my final answer, I'm going to take 3.6 times 250, 900 divided by 50, and I get 18 ml per hour. So those are some good questions. And really the only difference between what you're doing here and what you're doing with like a units per hour thing is just you're just dealing with different units of measure, right? So heparin uses units, nitroglycerin uses micrograms, insulin uses units, and so that's what that is. So okay, so we have about 8 more minutes left of the review. Any other questions? I'm getting some good ones in the chat, and so I'm trying to touch on those. And this is one of the questions I was going to go through, is because I knew it was a little bit more of a challenging question. If you weren't here on um, Tuesday, this is I went through this question because you're going to see questions like this in pediatric dosage calc, where basically they're going to want you to be able to assess a range. And what they mean by that is, at least for pediatric dosage, is you want to know what the low end of the range is, the high end of the range is, so that when an order is prescribed, is it safe? Because if it's too high or if it's too low, then it's considered unsafe because, well, that's what the label says. The label says it needs to be within that particular range. So, okay. So you can review that from Wednesday's review. And I'll leave the work up here just so you'll be able to see it. And like I said, I'll put this up on the OneDrive folder so you have access to it. Um, I'll go through a reconstitution question because I think that's the only one I haven't gone through with the reviews for 230. Let's see if I can find it. There we go. Okay. Grab that other one. It's hard to read this, so I don't know that I'm not going to worry about that one. So I'll do this one because I can read it. So with reconstitution, as a reminder, you've seen this now the last 2 semesters, so this shouldn't be new. Whenever you're dealing with a reconstitution question, you just need to remember that you're dealing with you'll know that you're dealing with a reconstitution because it'll say IM or intramuscular. Sometimes it'll even tell you to mark a syringe. So you know you're looking for mLs, and you know you're looking for, in order to use mLs, your label should indicate how much of a particular medication per ml it is. So this just tells you 500 milligrams, which doesn't tell you anything about the concentration. It just tells you that it is 500 milligrams. So this is your clue that you're dealing with reconstitution. It also sometimes will say it within the label, but it's your clue to look at the side label to find out what your concentration is. So what you're looking for is where it tells you like how to administer it. So like it tells you to add 2 ml, then it'll give you an approximate volume of 2.2. But what you're really looking for is the 225 milligram per ml. That just tells you what to actually program into your, or not program, what numbers actually use when you're calculating this. That's the trick. You've done reconstitution problems with just standard labels. This just adds an element of you need to be able to read the label. Okay. So what we're going to do is once we have found that, we're going to take our order, the 0.375 grams, and then this is one that if you like to use order over available, that works out perfectly. So the first thing I'm going to do is I'm just going to convert the 0.375 grams to 375 milligrams because my available is also in milligrams. So if you're doing ordered over available, my available is the 225 milligrams and then my ml. And then you just plug it into your calculator. Like I said, no one asked this question, but I felt like it was good to review it again. So 375 divided by 225, I get 1.6 repeating. And so you would just answer that as 1.7 ml. And if there was a syringe to mark, you would just make your mark at 1.7 ml. So, all right. So that, I mean, those are the types of questions to pay attention to. You have access to the review material here. So, but if you have any questions between now and next week when you take your test, feel free to email me and I'll try and get back to you as quickly as I can. And if there are no other questions, then we can stop there. But if you have any other questions, just let me know. Um, I'll just be here. You're welcome.
Thank you.
You're welcome.